My niche is the fact that I'm a primary care doctor first and functional medicine as dessert. And so it's kind of like the cherry on top of the piece of cake. We, as physicians especially, we were taught to keep someone alive. We were taught to give them a drug and to help them stabilize, but we were never taught how to prevent something from happening. We were never taught that the intervention of food or the intervention of lifestyle change can actually change someone's life. Most of my patients really come in with a lot of fatigue. I have a lot of people who come in with autoimmune disorders who they have just been told, well, you just have to take a medication, this expensive medication, and you're gonna have to be on this for the rest of your life, and you're not gonna be able to get off the medication. And so when I tell them a different story, I give them a different diagnosis, or I give them a different outcome, that's really surprising to them.
I was tired all of the time. My stomach hurt. I stayed bloated. I had digestive issues. I was not sleeping. I found out that I have low stomach acid, so my food was not being digested. I had low B vitamins. I had low iron, and my cortisol levels were not where they should be.
I was having a lot of blood pressure problems. My blood pressure kept going up. I was having a lot of anxiety, a lot of panic attacks. I was having a lot of problems with my allergies. I couldn't eat anything, and in short, I was just miserable. So after all the tests and everything, it was discovered that the problem was in my gut. And that nobody else was trying to search for that. And that enabled her to, to get to the source of the problem. And so that was very relieving for me.
I hear patients saying that they've been to, multiple doctors over the years, and they either don't get the time that they need, they feel like they haven't been heard, they feel like they just, put a Band-Aid on it, give them a pill and say come back in a month. Dr. Harris actually tries to get to the root cause and treat it that way. Her goal is to keep you off medicine and to help you feel better by lifestyle changes versus just throwing pills at you.
Functional medicine is an additional training to my internal medicine training, which I'm an internal medicine trained physician. Functional medicine actually takes us back to understand that function of what's going on in your body. It just builds upon what we know, but it really takes it to the next level.
Being membership-based, we are able to allow more time, extended visits, and a lot more one-on-one patient care. We only see a minimum of patients a day, maybe between 6 and 8 patients a day versus trying to have to see 25 or 30 patients. We are able to form relationships and make friendships with our patients.
We consider this a family, and when we bring on patients, we want to keep them as long as we can. We want to establish long-lasting relationships at our practice.